Has my blepharoplasty gone wrong? I need a professional opinion. I just had a blepharoplasty done yesterday. When I left the office, my eyes were already noticeably uneven, and one of the top lids turned inside out. I am on day 2, and of course it's still swollen and looks about the same. The doctor I am seeing for my service said he knew how to do blepharoplasty on Asian eyes. I remember asking him in the operating room if he took off skin or fat. He did not. Please look at my picture and tell me if my procedure looks like it is done correctly.
Thank you for your question. You stated in your question, has your blepharoplasty gone wrong? And in the substance of your question, you're stating you had the surgery done 1 day ago. You had Asian eyelid surgery, and you're stating in the question in addition that you didn't have any skin or fat removed. And you're concerned about the degree of swelling and the appearance of your eyelids, and you've submitted very good photos. Well, I can probably give you some idea of based on my experience. I'm a cosmetic oculofacial plastic surgeon practicing in Manhattan and Long Island for over 20 years. Asian eyelid surgery is one of the areas of specialty in my practice. So I can give you some perspective based on how we do what we do and maybe how to interpret what you're going through right now. First of all, it's important to understand that it is in the absence of a physical examination with someone actually touching the area and seeing it firsthand and up close, it is still an opinion based on a limited amount of information, just photos alone. So based on what you described, it sounds like you had a non-incisional blepharoplasty. Non-incisional blepharoplasty is a little bit of a misnomer because the reality is that even for a surgery, for Asian eyelid surgery, where we're not removing skin and removing muscle or fat in order to achieve a crease, we're still making little openings. And in those little openings, we're putting a suture. That suture is engaging a muscle called the levator muscle. And the levator muscle is like the word elevator. It's the muscle responsible for lifting your eyelid and for creating a crease. Now in the photos where your eyes are closed, the crease seems very, very well defined. And so I think that what you can probably take away from this is that you had a non-incisional Asian blepharoplasty and that you have a significant amount of swelling afterwards. Now, it's important for you to at least have some sense of connection with your doctor. If you made this decision to have your doctor do this procedure for you, well, it seems a little bit premature to lose faith and to start asking questions on whether something went wrong. When we deal with eyelid surgery, you have to understand that even with minimally invasive procedures and a lot of methods that we do in our practice, including local anesthesia, light sedation, and other modalities, eyelid tissue is very prone to swelling. And the first 48 hours can be the peak of that swelling. So I think it's very hard for anyone to make an informed opinion based on just the photos alone. It's certainly the eyelid asymmetry and the amount of swelling and the eversion of the lashes is, in our practice, somewhat uncommon, but it doesn't mean that your doctor necessarily performed the procedure incorrectly. I think it's very important that you maintain communications with your doctor and follow the instructions given as to how to manage your swelling. For example, in our practice, what we tell our patients to do is to use cold compresses for 20 minutes on, 20 minutes off while awake for the first 2 days, including the day of the surgery. Then after that, it's routine for us to advise that patients move around, walk, talk, move, and open and close their eyes. A lot of times people who have had eyelid surgery, particularly Asian eyelid surgery, where you're trying to create this crease, they'll sometimes do what I call splinting, where they won't open their eyes all the way because they're afraid they're going to damage something. So they keep their eyes kind of halfway open. So I always tell patients to go ahead and look up a few times a day, just to let that that fold develop. It's really a matter of allowing the fluid to get absorbed where at the areas adjacent to where the connection between the skin and the levator muscle are. So again, make your follow-up appointments with your doctor and allow some time for the swelling to resolve. I always tell my patients that the space between the eyelid margin and the crease has a tendency to swell, and that swelling will of course be greatest in the beginning, but it can linger for a couple of months, and in rare occasions I've seen it linger for up to a year. Now it's not significant at that point, but it may very well be present. We've seen patients where it can last up to 3 months, and low-grade amount of swelling in that area. So there is some variability, but as long as the swelling is moving in the right direction and the eyes are starting to look more aesthetically pleasing, then as is the case for most of our patients, we send them back to work and normal life in a week and sometimes even less. So again, it's very important to understand exactly what your doctor did. If you're not getting details, learn more, ask the doctor for more specifics to understand what you're going through, and it may help reduce your anxiety about what you're going through right now. So I hope that was helpful. I wish you the best of luck, and thank you for your question.